Hello and welcome to Health Professional Radio. Thank you so much for listening today. In studio today with us is Tricia Paige, Senior Director with the J-Screen program at Emory University in Atlanta, Georgia. Now, after receiving her Bachelor's of Science in Genetics from the University of Georgia, she received her Master's degree in Genetic Counseling from the University of Texas Health Science Center in Houston. And she's here today to speak with us about the benefits of DNA sequencing. Welcome to Health Professional Radio, Tricia Paige.
Hi, thanks so much for having me.
As Senior Director with the J-Screen program there at Emory University, talk a little bit about what it is that you're involved in as a genetic counselor. And then let's talk a bit about, well, the benefits or maybe some of the drawbacks involved with DNA sequencing, okay?
Yeah, no, that sounds great. So I guess I'll start with just kind of what I'm currently involved with, and then we can move on to the other questions that you had.
Great.
I'm currently involved with a program called J-Screen, and what we are doing is we're trying to bring the kind of latest in genetic testing technology to people and making it as easy to access and affordable as possible. We are using sequencing, which I can talk a little bit more about why that's important in a second. But we're using sequencing specifically because we want to identify as many people who are genetic carriers for conditions as possible. And it's because it's really practical information. The testing that we do is done before pregnancy, so if a couple knows that they're at risk, then they can take steps to have a healthy family. And so sequencing is an excellent tool that helps us to accomplish that goal.
Is this covered by someone's health care? Or is this something that is reserved for, say, not necessarily the ultra rich, or at least the comfortably well-to-do?
Right. So I will say that increasingly insurance companies are getting on board with the benefits of covering genetic testing because we're really starting to show clinical utility, that it actually does make a difference in terms of someone's care and really how well they do in the future. So that most insurance companies will have some kind of specific policies around genetic screening. I'll just give you an example. There's one for people who are interested in cancer screening, for example. There's one insurance company that requires people to actually go and meet with a genetic counselor before they'll cover testing. So it's really, but if you do, and you meet certain criteria, then they will cover it, at a very high level, if not entirely. For some people, it's still inaccessible, and the program J-Screen that I work with, we actually we're a not-for-profit program. We have very generous donors who allow us to subsidize the cost of testing down to about $99, which is a great deal for people, who come through us. And again, it's just all about increasing access for us.
If someone were interested in becoming a genetic counselor, is this a field that is readily offered at the mainstream learning institutions, or is it something that, you have to find a specific college to get access to such courses?
There are specific training programs for this. The field didn't exist at all before 1969 when Sarah Lawrence College in New York started the first training program. When I applied for school, like in 93, there were only 9 programs in the country. So that's why I went to Houston. I'm from Atlanta myself, but I went to Houston because that's where I got in. And now there are around 32 programs around the U.S. So there's 3 in Canada.
Not many.
That are all accredited. But that's it. Yeah, it's a relatively small number of programs. It's fairly competitive to get into them for that reason.
Is J-Screen specifically involved in any grants or some type of assistance for students who want to go into genetic counseling and then maybe transition specifically into the J-Screen program there at Emory with you?
Yes, we are really fortunate in that here at Emory University, where we're based, we have one of those training programs. So we are really fortunate in that we've had several students work with us to do those training programs are a master's level, and so they've done their thesis with us, and they do clinical rotations through us. And well, I haven't hired anyone out of our training program yet. I certainly would if we had an opening and needed to do that. So it's really a privilege and one of the pleasures that we have in terms of having students around.
Are there counselors who counsel in just DNA sequencing, and what type of patient would need to know the details of such a procedure or testing? Isn't that something maybe reserved for the researcher, the test lab, and then the attending physician?
So now I will tell you, sequencing is becoming more and more mainstream. And most genetic counselors are going to be comfortable talking about sequencing and understanding kind of the pros and cons of it. Where there are some specialists that the technology, has advanced to now where we can do sequencing of someone's entire genome or their entire, what's called exome, which is basically the part of our genome that gets used. And there are counselors now who specialize in interpreting the entirety of someone's genetic makeup. And that's really, the kinds of people that are doing that now are typically people that have been on a diagnostic odyssey, what we would call an odyssey. So they've really been looking for a diagnosis for a health problem. Often these are children that have maybe multiple problems, multiple issues that no one has just been able to put together, why this is happening. And so in that sense, you go in and you look at everything. And so there are, and certainly genetic counselors don't do that by themselves. We are always part of a team. There are always the laboratory, directors, there's physicians, we're always part of a team, but genetic counselors do a lot of the digesting of the information and then explaining it to patients, and hopefully a way that they can take that in and understand and use that information themselves.
Thanks. You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been in studio talking with Tricia Paige, Senior Director with the J-Screen program at Emory University in Atlanta, Georgia. And she's been here today on Health Professional Radio with us talking about the benefits of DNA sequencing and also some of the ways that J-Screen is allowing students to learn genetic counseling and step on into the career, whether or not they're at Emory University or some similar program here in the United States. It's been a pleasure talking with you today, Tricia.
Great. Thank you so much.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. And you can also subscribe to our podcast on iTunes.